Just about 20 minutes after the hour of 7 o'clock, welcome back to the Now Morning Show. Now, in today's segment, we're going to be talking about lower extremity amputation prevention with Chief Executive Officer and founder of Realm Labs, LLC, Dr. Richard Mann. Dr. Mann is a doctor of podiatric medicine and a diplomat of the American Board of Podiatric Surgery, retired. He is the Chief Scientific Officer at Realm Labs and the medical advisor to All Care Home Services Limited. Dr. Mann will address or discuss lower extremity amputation prevention as part of his clinical update series, Preventing Diabetic Foot and Leg Amputations Due to Peripheral Neuropathy. Dr. Mann, good morning. Thank you so much for joining us on Now.
Good morning. Thank you for having me.
I mean, I just read piece of your bio and I could understand exactly why we would have wanted to have you here to have this conversation. So I guess a good place for us to start is just explaining what is lower extremity amputation.
Well, lower extremity refers to anything below the hip. So it's the thigh, the leg, the foot, the toes, etc. Amputation is self-explanatory. What happens is it's most common in diabetics, and the diabetics are at great risk, especially in the Caribbean and on your beautiful islands of Trinidad and Tobago, for amputation of the lower, or a piece or a part of the lower extremity. And that's because diabetics tend to get wounds into their feet and legs, which have difficulty healing, and as a result may go on to an amputation. The problem is multifactorial. There are many things going on, but one of the most important elements of it is lack of protective sensation. Sensation in the feet protects your feet. Sensation is protective. Some doctors talk about the gift of pain. But what happens in diabetes, the pathology of the disease eats away at the nerves. It eats away at the ability of the nerves to go ahead and to inform the brain that there's a problem with the foot. So if you have a numb foot, if you've lost your protective sensation, then you are prone and you are vulnerable to getting wounds. And wounds can occur in many, many ways. One of the most common ways in which a person with diabetes and decreased sensation gets a wound is by walking barefooted. So if you don't have any feeling in your foot and you're walking and you step on a stone or a pebble or a shard of glass or a nail, that'll puncture your skin and you won't know that you had a skin that was punctured. And people tend to realize that after they see the consequences of the wound, which is swelling, redness, pus, etc., foul odor, and then they seek care. And by that time, it's much more difficult to heal the wound. Other things that cause wounds on a numb foot would be improper shoes. If you go ahead and you have a pair of shoes like a flip-flop, a sandal, a pair of cheap plastic shoes, these are not designed for feet that are numb. These are designed for other reasons, and they can damage you, they can hurt you. So you have to wear very, very good shoes, diabetic shoes, or shoes that are constructed in a manner that don't damage your foot. Yeah. And you want to make sure that there's nothing inside of your shoes so that you have you're not walking on a pebble or a tack that happened to fall into your shoe. So increasing sensation is a primary goal here in diminishing the rate at which wounds occur in the feet and legs, and at which you have to go ahead and undergo an amputation, which is a horrible
experience. Now, Dr. Mann, I just want to jump in here because I wanted to know, you would have mentioned that the LEA, I'm going to abbreviate it here, it is very high with us in the Caribbean and TNT. Can you give us some data in terms of the rate at which it happens, especially for us here in TNT?
Well, the best data we have is from 2004, a paper that was written by people looking at the incidence of lower extremity amputations in Barbados, and it was about 1% of diabetics published, which is an extraordinarily high number. If you think about the fact that a diabetic may have diabetes for 30 or 40 years, I mean, do the math. If 1% of all the diabetics are going to undergo an amputation, that's an astoundingly high number. The most recent number that I've read about in Trinidad and Tobago was that there were 600 lower extremity amputations on your beautiful islands last year. So the numbers are really quite high.
Yeah. And
And
then how will,
what's significant is a lot of it is preventable. That same study showed that if you wear appropriate shoes, if you wear good shoes, you can decrease your chances of getting an amputation by 2/3.
now you keep saying good shoes, Dr. Mann. What does good shoes look like? Is it having a proper sole? Is it something that doesn't squeeze your toes? I mean, what is a good and proper shoe?
That's a great question. So, a walking shoe that's appropriate for a diabetic is one that has no seams inside of it. It looks like an expensive or a well put together walking or running shoe. It has an insert. There's no seams inside. It's not. It's made of a good material. It's not made of a cheap plastic. No high heels. There are many ways of determining it, and some shoes are constructed specifically for diabetics.
Yeah.
So a good walking shoe is something that protects your foot, wraps around your foot, protects your foot, and when you buy a shoe, your feet, everybody's feet swell depending on the time of the day. At the end of the day, your foot is more swollen than at the beginning of the day. So you want to buy your shoe and have your shoe fitted at the end of the day when your foot is largest, so that the shoe has less chance of damaging you because it's too tight.
Yeah. Now, one of the reasons you would have mentioned for the amputation, of course, is diabetics because of that numbness and the lack of pain that they feel. But is it also possible for somebody to need to have one of their lower extremities amputated, for example, if they have blood clots or if there's poor circulation in the legs as well?
Well, there are many, many reasons that people undergo lower extremity amputations. It could be vascular, you could have very poor blood flow, et cetera. It could be traumatic, it could be an infection, and there are many reasons, but the vast majority of people who undergo lower extremity amputations are diabetics, and as a result of the complications that occur from diabetes, including poor circulation and the inability to fight an infection, as well as someone without diabetes. But the primary problem is lack of protective sensation.
Now, I know that there's a certain drug that can sort of, I'm not sure if it's to remove the risk or to help the risk, but it's called Neuromatic Remedy. New remedy.
Yes,
Can you tell us some more about it? Yes.
yes, yes, I can. I actually named that drug Neuromatic. It's not a drug. It's a nutrient formulation. The primary ingredient, the key ingredient in it, has been used for the past 60 years worldwide. I introduced it into the U.S. about 15 or 16 years ago. We have tens of thousands of people on it, and I was fortunate enough to align myself with All Care Home Services in Trinidad and Tobago, who make the product available. Neuremedy is a nutrient that improves the functioning of the nerves in your feet and legs. So it's well documented that people who have diabetes, one of the contributing problems with respect to this dysfunction or inability of the nerves in the feet and legs to work properly is that there's a vitamin deficiency that is occurring that is hampering the ability of the nerves to work properly. And Neuremedy is a specialized formulation of the vitamin that goes into deficiency. And when you improve the amount of vitamin available to the nerves, you improve the way that the nerves function. So we've had people who've had increased sensation, decreased pain, decreased numbness, decreased cramps, et cetera, in their feet. And it's all because of a nutritional deficiency, a vitamin deficiency that you can reverse with the appropriate vitamin formulation, which is Neuremedy.
Yeah.
And many times people who had numbness to the extent that they couldn't feel their feet and they were at risk of having damage to their feet because the feet were numb, they improve so much that they have some sensation, and any increase in sensation is a very, very desirable goal in diabetics, and that's what Neuremedy does.
Right. And Dr. Mann, at what stage do you begin taking this medication?
Well, there's a case to be made that anybody who's a diabetic should take this medication because diabetics in general are deficient in the vitamin that causes this problem. But certainly if you are sensing that you have any decreased ability to feel with your feet, if you have any numbness, if you have any tingling, if you have any burning, if you have any pain, anything that feels as though the nerves are not working properly, you should be taking Neuremedy. And you'll know within a month's time. Because we're reversing a vitamin deficiency, this happens very rapidly. And it happens within a month's time. Most people know within 30 30 to 60 days. Also, if you stop taking it after we reverse this deficiency, this vitamin deficiency, and by the way, it's vitamin B1 that we're talking about.
Right.
After we reverse this vitamin B1 deficiency and your nerves start working properly, if you stop taking the Neuromatic, you go back into vitamin B1 deficiency and your symptoms return. So if you've had relief from the numbness, tingling, burning, and shooting pains that occur with diabetic nerve disease in your feet and legs from Neuromatic, and you stop taking it, you get a recurrence. So generally people want to stay on it for an extended period of time.
Yeah. Now, Dr. Mann, you would have said that somebody who has the numbness in their feet and their legs, they should start taking it. But is it wise to maybe consult a physician first to see if it is you are diabetic or if anything is wrong with you before you go on the supplement? Or is it safe to take without that consultation?
Well, I would never discourage anyone from seeing a doctor. It's always a good idea to get a doctor, get a professional opinion. You certainly should go to a doctor to have your feet examined for deformities, to check out your circulation. This is very important stuff, but you don't need a doctor's prescription to take the product. If we have a little moment, may I tell patients or people how to get the Neuromatic on the islands?
Of course, yeah. Okay? But before we get to that, doctor, because I know that's my final question. So in terms of the medication itself, just to confirm, it is not something that has to be prescribed. Once you go to the local distributor here, you can purchase it over the counter?
Like any other vitamin. It's not a medicine. Although people think it's a medicine because it works well, it is not. It's not. You do not need a prescription. You can take it. It's safe to take with other medicines, and it's safe to take with other vitamins and medications. Although you should always consult a doctor if you have diabetes or you have any problems that you need medical advice for.
Of course. And now, Dr. Mann, quickly, you can share where people can find Neuromatic.
Well, the organization we're involved with, our team, is All Care Home Services, and you can reach them on Gmail by allcarehomeservices@gmail.com. You can call them at 707-0680, that's 707-0680, or you can follow them on Facebook and Instagram at All Care Home Services, AllCareHomeServices.
Nice. And tell me one more time, Dr. Mann, just remind me of the phone number again.
Phone number is 707-0680, 707-0680.
Great. Dr. Mann, thank you so much for coming on the show and just sharing about Neuromatic. And of course, it's a supplement that can help diabetics in particularly. Thank you so much.
It was a pleasure and an honor. Thank you for having me.
You're welcome. And that was Dr. Mann just sharing about a new supplement that can possibly help diabetics and those suffering from lower extremity, or at risk rather, of lower extremity amputation. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.